Oh, absolutely. We prefer to use the term birth preferences because, plans can go awry. So we say preferences really. And what we like women to do is to draw up a list of their preferences and then discuss them with their midwife or obstetrician to make sure that everything is in line to what we can do and can provide here. That is then signed and put into the chart. And as far as we can, we would respect and honour all choices for our women here.
We at the Rotunda Hospital never use the term geriatric mother or elderly primogravid. These are phrases that you will see online and in older textbooks. The average age in which patients have babies now is continuing to increase. About a quarter of all mothers at the Rotunda Hospital are 35 years of age or older. This is certainly not geriatric. This is not elderly or any of these other phrases that you will sometimes see used online. We, frankly, at the Rotunda object to the use of those terms, and we support all of our patients and encourage all of our patients in their pregnancy, irrespective of their age.
Well, one of our issues here is space. We're very short of space in the hospital here. So we don't really have space for a second support person for every woman coming in labour. And in fact, most women just want to have one partner with them. But if somebody has a very special request to have somebody with them, they're usually write to me and I'll review the request and see if we can manage something for them. But yes, we don't say no, but we can't always say yes is the answer to that.
The Rotunda Hospital does not have a policy of routine episiotomy. Instead, we adopt a policy of watchful waiting. What this means is, as the midwife is attending a mother at the end of labour, as the head is crowning, the midwife pays careful attention to the state of the skin at the back of the vagina. If it looks as if that skin is stretching up adequately and does not look like a tear is about to happen, then we take a hands-off approach, just supporting the patient's skin and muscle area there. However, if it looks as if the skin is very taut or it might tear back towards the rectum, it is better if the midwife or doctor performs an episiotomy, which is a cut in the skin at the back of the vagina out to the right side. This protects against a tear going into the rectum. These episiotomy procedures, however, are not performed at the Rotunda as a routine, only if, in the judgment of the midwife or the doctor, that a tear is about to happen. And in all cases, there should be a discussion with the patient first so that she knows what's happening or what her choices are. In the early stages of labour, patients often have a persistent low back pain. In that situation, sometimes having a bath, getting into the shower, using a hot pack, or indeed taking some Panadol may help in coping with the pain in early labour. Paracetamol, however, is generally not an effective form of pain relief once labour becomes established.